Welcome to this assignment overview for the 1809 Effective Nursing Practice course. This short video will hopefully give you some guidance and advice on how to go about writing your assignment and what is expected within your essay. So, let's take a look. This essay is based around a case study of Mr. Doug Sultan, or Uncle Dougie, who is an 88-year-old Aboriginal elder and is a resident of Sunnyside Aged Care Facility. Uncle Dougie is a widower but has two daughters, with one of them visiting daily, along with many other relatives of Uncle Dougie's. Uncle Dougie is underweight for his height, is unsteady when mobilising, and therefore uses a walking frame. Recently, he's been complaining of abdominal pain and has had 3 episodes of diarrhoea since breakfast. As another resident at Sunnyside has the same symptoms, and because norovirus is a common reason for vomiting and diarrhoea in residential aged care facilities, it is assumed that this is the cause of Uncle Dougie's illness. Now that we know the case study, what needs to be completed in this assignment? Well, there are 3 main parts to this assessment as highlighted on the assignment description. Firstly, we need to focus on norovirus. A description is needed first, so what exactly is it and what can cause it? Explaining its modes of transmission is also important. How does norovirus get transmitted? What examples can be given? How may this be seen in the aged care setting? What about the specific health risk for the elderly? If an elderly adult was to get norovirus, how would this affect them? Is there specific risk to the elderly that we need to be aware of as registered nurses? In the next section, we need to focus our discussion on infection control and prevention precautions in relation to norovirus. What precautions are needed for someone with norovirus? What specific infection prevention and control precautions are needed in the clinical healthcare setting? How should this be managed within this type of environment? Lastly, a discussion is needed in relation to another risk assessment needed for Uncle Dougie. We've already mentioned risk to the elderly, so what risk assessments might be required? With Uncle Dougie having norovirus, we should probably be concerned with other risks. So what assessments are needed? Remember to clearly explain why this assessment is needed and why it's important to Uncle Dougie and his nursing care. Remember also in this section to consider the nursing care that we will deliver to Uncle Dougie and how we can ensure that this is culturally appropriate for him. Well, that's the essay in a nutshell. However, a few more things to be mindful of are to make sure you have clear and concise introduction and conclusion. Feel free to use subheadings if you would like. Ensure that you use the university's assignment formatting guidelines, and these can be found within the Griffith Health, Writing and Referencing Guide on the course site. Try and avoid casual language and use academic language throughout. You don't have to sound super fancy and clever, just small changes are often needed. Try and replace words like didn't with did not. And when you read the assignment back, if it sounds like a conversation with a friend or a set of instructions, it probably needs a little bit more work. Please remember, only use third person, so no discussion should be saying I. Ensure your essay is supported with scholarly literature, with at least 10 being used from the last 5 years. When using these sources, make sure you're using APA 7 to reference them, with all statements and facts being supported with evidence. If your discussion makes a claim with no reference, your marker will be thinking, how did you know this? In regard to using evidence, try your best to avoid direct quotes, as these do not specifically show your understanding on the subject, but that of the original author. Take time to think about what you've read and put it in your own words. Your word limit needs to be strictly adhered to. After 1500 words, your marker will stop reading. So for example, if your conclusion was not included in the 1500 words, it will not get read or marked. Be mindful that everything in text, such as references, direct quotes, and subheadings, gets counted in the word limit. Only the reference list is not included. Lastly, ensure you leave enough time to put your essay into the draft submission point, as this will show your essay's similarity so that you can fix any areas that are too close to the work of original authors. Good luck with your assignment, and please ensure you ask any questions on the discussion board. Bye for now.